hold on 1 second. I'm going to go to the beginning. Sorry, y'all. Hold on 1 second. Technical difficulties. As always, happy Monday. All right. So we are here for Housing First training, and you all will learn a lot more about Housing First. If this is new to you, you're going to learn a lot. If it's a refresher, we're going to have some more interactive activities for you. So just a few things about housekeeping. So we're asking everyone to stay muted, and if you are accidentally unmuted, we're going to mute you. There will be times when your speakers and presenters will have time for questions. You can unmute then, but also ask you to use your little raise hand feature. But you can also put things in the chat. Just a few things about training norms and agreements. So we're asking folks to respect the trainers, respect the other attendees. Make space and take space and share the mic. So this really means, and actually the last one too, acknowledging power and privilege, just sort of being mindful of how much space you take up in the training with questions and comments. This is a good challenge for me because I'm a talker, but also encouraging those that tend to hang back a little bit. This is a great opportunity to step forward, ask questions, and share. So this training is part of a training series that we do all year round. So H3, Health, Housing, and Homeless Services, and I have a couple of my colleagues here. We're sort of like the conductors for the homeless system of care. This are part of the team. And one of the things we do is help make sure that all the providers in our community have trainings about essential information and skills. And we'll talk a little bit more. Some of these things are required by HUD, the federal government, who's the biggest funder, and some are things that we've decided as a community, as a system of care, are really important. So these are hosted the second Monday of every month, unless it's a holiday, and then you'll know. And they are required for direct service staff and program managers. So some of the trainings, like Housing First, are required. And others, you'll see we have some that we've required, as I said, through our community, where even though our big funders aren't requiring it, we've decided that they're really important for everybody to understand. So we always put these little breadcrumbs in here if you're like, well, who's requiring this and where does it talk about it? So HUD has information all through their stuff about Housing First, but also in our CoC written standards. And if you don't know where those are or what they are, you can ping me separately and I can get you a link to them. But there's a reference on page 18. Shelby, I'm going to turn it to you for a second to talk about monitoring.
Sounds good. Thanks, Jamie. Hi, everyone. Good morning. As Jamie said, attendance for these CoC trainings, these monthly trainings, is required and monitored by H3 staff, mostly myself. We talk about during quarterly meetings whether your staff attended or not, so please make sure you have at least one staff member who's directly working with participants attend. And myself or Mary, check in regularly with you all to make sure you're attending. Anyone who might be struggling with attendance definitely want to check in. So if you are having trouble attending or, getting your staff to attend, please reach out to me and we can figure out maybe another time for you to view the training or something like that. So let me know in advance if you know. I'm happy to work around your schedule.
And thanks for that, Shelby. And I did want to mention, so this will come up, guarantee you. I feel like I want to offer a prize. So we will provide the training recording and the slides. So we post them on our website and we can drop the link to where all of our past trainings are, but we are also going to email you all directly with that information. So this is not your last chance. You don't have to take copious notes. You can, but you're going to get all this information after. The other piece I just wanted to mention, this year we're really trying to put a finer point on equity. And part of the way we're trying to do that throughout our whole system of care is in our trainings, you're going to see a couple pieces as we go along. We're going to be providing data on equity related issues on whatever the topic is, but also just want you all to hold these questions in your mind as you go through this training. Have you noticed inequities in your own work on this topic? And inequities basically means, do you see that different groups of people are having different experiences based on, could be age, race, ethnicity, gender orientation, sexual orientation, disability status, starting to really look at what's happening for people in our system of care through this lens, Have you contributed to or interrupted inequities? And then what barriers might still exist? And how do we think they could be addressed? So these are like rhetorical questions. We're not going to ask you to we're not going to do a quiz, but just hold these questions in the back of your mind as we go through the training. And with that, I'm going to turn things over to our trainers. So we have David Dirks, who's directing attorney and racial equity action and coordination team, the REACT team lead for home base. Michelle Burns. Oh my God, Michelle, am I saying your last name right?
It's Burns.
Burns, sorry.
Yeah.
Like I haven't known you for years. Directing analyst and Riley May, research associate with home base. With that, I'm going to stop sharing and turn it over to them.
Thanks, everyone. All right, I'm going to share our screen today. So thank you all for joining us. This is a really big crowd. We're going to do some interactive activities today, so we hope there's still space for everyone who wants to speak up to speak up. But as Jamie just introduced us, I'm Riley Meave from Homebase. I'm a research associate, and we're going to start today with a poll of who's in the room to kind of thank you all for already introducing yourselves in the chat, where you're from, but we kind of want to get an idea. We do this at many Council on Homelessness meetings to see kind of people's lived experience of homelessness and the racial and ethnic breakdown of folks in the room. So I'm going to launch that poll. It should show up in the middle of your screen and you can answer. So everyone should be able to see that now. And let us know if you're having any difficulties with it. And just as you're filling that out, yeah, just a reminder, we're really trying to make this Housing First training today really about practical implications of housing first that you may all be dealing with in the everyday. Most of you probably have gotten a lot of basic information about housing first before, and so we're hoping today there's a lot more opportunity to work through the actual challenges you're experiencing, and we're going to do that by running through a few case studies. And I'm looking at the poll. Thank you all for participating. We'll give that a few more minutes before we dive in. Okay, I'll give it about 80% of you have filled it out so far. Thank you very much.
I'm an overachiever. Where are the folks that want to receive an A? Where's the 9? There we go. Come on. More people complete the poll. It's your first time meeting me, so this will be exciting. You will see me more often in Contra Costa, so get used to this voice, but we're trying to get 90% or better. I'm the hype guy for a lot of different things.
We're at 84%. 85, no. I think
more people that come in.
Yeah.
No, it's all good. Thank you all for participating.
All right. End the poll. I'm just going to share the results really quickly, just to see. This is all anonymous, obviously, so just to see who's in the room. So majority of folks in the room don't have lived experience of homelessness, but we do have almost over 30% that do. And here is the racial identity breakdown of the room. So
and Riley, we almost have about 40% actually, with over 15 having what would be considered sort of a recent experience of homelessness. So that's really good information to know.
yeah, thank you, David. All right, so we have a lot of material today, so we're going to dive in. And first, we just have a few reminders. Jamie's already gone over a few reminders about how trainings work, but just want to let everyone know that closed captioning is available today for you all. We're recording this training, and you will have access to the slides and the recording after this training. And if you have questions, Michelle, Dave, and I are open to receiving questions in whatever way is most comfortable for you. So, raise your hand, unmute, or put your questions in the chat. We'll be monitoring in multiple ways to make sure that your questions are getting answered. And then also let us know if you're having any tech issues too. So we've already introduced ourselves a bit, but again, the home basers on this call that facilitating this training are me, Michelle, and David. And for those of you unfamiliar with Homebase, we're basically a technical assistance nonprofit. We help communities address their capacity for ending homelessness. And we are assisting with many projects in Contra Costa County. So it's likely that you've probably seen us here before. We help with facilitating trainings like here today. We also help facilitate council on homelessness meetings, as well as committees and the annual CoC NOFO competition local process. And if you have any questions about any of the work we're doing or something that comes up in a meeting that you see, you can always reach us at contracosta@homebaseccc.org. And I just put that email in the chat. So we have this slide here, just kind of a few reminders about why we're here. CoC trainings can get a bit granular, and we're hoping we can get granular today in our conversations with you all. But before we dive into that really specific content, it's also important to take some time to zoom out and remember, like, why are we here, why we're doing this. And so each person here today and the programs that you work on servicing the community all have a crucial role to play in ending homelessness. And Contra Costa is a community facing an urgent and challenging housing crisis, and you all are helping people in their crises navigate this housing landscape. And our homeless response system is only as strong as each component. So these trainings are an opportunity to embolden each part of the homeless response system. And this work is really hard, but it's important. So keep in mind as you're here today, what's bringing you into this challenging work as we go through material and case studies today. All right, so here are our learning objectives for today's training. We're going to be discussing the key characteristics and principles of Housing First. We'll be talking about some of the individual and community benefits of Housing First. And then throughout the presentation, we have weaved in important conversations about the relationship between equity, implicit bias, and Housing First. And then most of today is going to be spent on the actual implementation of Housing First. And we tried to cut down on spending time going over more of the basic information about Housing First, because we wanted space for you all to work out what can be really frustrating about operating a Housing First program, but also like what are the getting to the real strengths of Housing First as well through that. Now before I pass it off to David to talk about our next slides, we wanted to do a quick check-in again, another poll. Maybe this one will get 90% participation on. So we just wanted to kind of get a sense of how long everyone here has been part of the homeless response system, either through having lived experience of homelessness or working in the homeless response system. And then we also want to kind of gauge your level of Housing First principles. So I'm going to launch that poll right now. And it should, again, pop up in the middle of your screen. And just we'll take a few minutes to fill that out and assess the results.
While that's happening, you all can't see it, but it's really fascinating to see the poll move. So just encouraging people, but I'll keep you updated on where we are. We're at 50%. Okay. 60, keep answering. Slowing down just a little bit. Hit 80%. Stuck at 84. There we go.
This seems to be kind of our magic number around 84 to 86. So we're going to end the poll and share the results. So, all right, for both questions, there's a good amount of variety in answers. So in terms of participation or involvement in the homeless response system, some of you here have had 10 plus years of experience, but some of you are maybe more at the beginning of your journey. So that may influence your level of exposure to Housing First today. And then we kind of see that reflected in the second question based on how all of you rated your knowledge of Housing First. And some of you are still beginners, so we're going to take account of that as we're introducing the definition of Housing First and the basic principles. But also, some of you are experts and feel like you know this very well, probably because you're operating Housing First programs. So we've designed today's training to make sure that everyone, wherever you're at, will be able to participate. But this helps us get to know our audience better. So thank you to all those who participated. And I'm going to pass it to David.
Thank you, Riley. And again, everyone, David Dirks here. Really, really nice to be sharing this space with you all. Before I jump into this content, I really wanted to just make way for you all completing, especially that first poll. The reason why we ask those questions, you know, whether or not we have folks with lived experience, folks, race, ethnicity, we really want to honor everyone that's being here, right? We're a collective community trying to end homelessness amongst the most vulnerable in Contra Costa. So how we continue to show up and honor one another through this work is really so important. So we ask those questions to really see who's in the room and to make sure that we honor each and every one of you and the expertise, the lived experience that you bring, the perspective that you all bring to this work, because it's so important to do that. This work is hard, it is not easy, and we need to make sure that we honor each other and we celebrate just each other for being here, because many of us could have chosen any other type of career, but we're here and we're doing this really important work. So I just wanted to set the stage. Many of you have had some exposure and experience with Housing First. One of the things when I talk about Housing First, and I've been in this field as a case manager, a job developer. I went to the National Alliance to End Homelessness, and now I'm at Homebase. And I'm also an attorney, and I do work in the community here in the Baltimore area. And in DC, helping people through the eviction process and really making sure that folks' rights and protections are constantly at the forefront. So equity is really something that I trust in, I believe in, as well as Housing First. I like to coin Housing First as an equity issue, as an equity sort of intervention, right? The practice of Housing First in its essence is more, it's grounded in equity, right? We want to ensure that the most marginalized, the most vulnerable individuals that face systemic barriers and discrimination, which we know exist, whether it's through outside systems that end up touching the homelessness system of care, but we want to make sure here in the homelessness system of care in Contra Costa that folks are not further marginalized by complex eligibility requirements or exclusionary practices, right? So the pure practice of Housing First is grounded in equity. We also recognize that everyone, regardless of their background or circumstances, deserve the opportunity to have a place to call home. So those principles in and of itself, again, are grounded in equity. And we can go to the next slide, please. Thanks, Riley. So we just want to really list and talk about some systemic barriers, which you all may be very much aware of, but we know that people experiencing a shelter homelessness are 10.5 times more likely to have police contact than people experiencing shelter homelessness. Black people are overrepresented in the national, state, and local homeless population. We know that Black Californians experience homelessness are more likely to have a history of incarceration. So sort of the criminal legal system sort of and how that impacts the people that we're serving in our homeless system of care. There's true issues with how folks are being impacted by that system and how that may impact the work that we're doing with them as well. Okay, next slide. So looking a little bit closer here at the racial disparities in homelessness in Contra Costa, and again, if you're not familiar with this stuff, I would implore you all to get familiar with your data, know who's touching the system, know who's being represented and who's coming to access services. We know that Black people in Contra Costa are overrepresented in the homeless population, 4 times than their white peers, okay? Native American people are 8 times overrepresented in the homeless population. So in talking with the team at home base and looking at the slide, I made the actual observation that you can't even really see the Native American line in terms of the total population and the population in poverty, right? But you can see it in the PIT population. So one, it is really telling to see that the population is so low there in Contra Costa based on, the census or whatever other data we're pulling from. But when every year at that pit time count that we have 9% people that are Native American that are experiencing homelessness in Contra Costa. So this map, and this is no different than pretty much in a lot of communities in this country, what we see is that, you know, the correlation between poverty and those folks who are experiencing homelessness, that is not really that strong. Poverty is not necessarily a direct indication of a person experiencing homelessness, and that in and of itself lets us know that something is going on. We have to start asking ourselves questions, sort of why is this happening, and why is this happening in Contra Costa? But this is the data. We always start with the data, and then we start exploring some of those and really looking at that data to really explore what's happening there. Okay, next slide, please. So I want to moving from data to sort of this concept of implicit bias. And I believe that you all, again, this is my official first training in the community, but you all will be seeing me more often. But implicit bias is really an automatic reaction that we have towards other people, right? It is the unconscious attitudes and stereotypes, the beliefs that we have and that can negatively impact our understanding, our actions, our decisions, our policy making, our rules. That implicit bias is something that we all have, right? We've all been taught and preconditioned through the media that we watch, some of us through the families that have raised us, for better or for worse, in instance, and we all have them, right? So we have to talk about and hold this place of implicit bias, right? And one thing that I like to stress in this, when we're talking about bias, and really we're talking about sort of racial bias, age bias, gender and sexuality bias, the implicit part is really the unconscious, right? The moment we become aware of the biases that we have and we act on those biases in a negative way, we're now teetering a little bit further on explicit bias, which can be the ageism, the sexism, the transphobia, all of those different things will, we have to be careful because that old saying, when you know better, you do better, right? So the fact that we all have these biases, we all understand that. Now we have to talk about how do we do things differently so that we're not letting those bias impact the type of service provision that we're providing to people that come to our doors for help. Next slide, please. All right, so this is a check-in question. Again, we wanted this to be interactive. I see some of you are in your cars. I know you're out there doing outreach, so just honoring all of the different work that you all are doing. But we did want to do a check-in question, and you can, I don't think we have another poll, so you can at least come off the mute if you want to, or definitely put it in the chat. But do you think implicit bias affects access to homelessness services? Oh, it's a Mentimeter, sorry. And then we have a Mentimeter. So those of you who are, in the car looking at this on either a device, you can just put the answer to those questions in the chat function. But Riley's launching the Mentimeter now, and she's going to share that in just a few. So give us a minute. And that question was, do you think that implicit bias is affecting service delivery in the homeless system of care? I said it a little bit differently. But for those of you, if you have your phones handy, you can either use this QR code, or you can click the link that Michelle and Jamie just put in the chat as well. Just gonna hold some space, and that awkward silence will come in, but it's okay. We're gonna allow folks to kind of get on this Mentimeter and start answering these questions. It looks like, yep, you all are coming in, about 29 people so far.
But yeah, if Mentimeter isn't an option for you based on where you are zooming in from, you can always use the chat, or you can even DM us if you want to keep your response anonymous but still want to participate. So whatever works for you. And we'll go to the first question now that it looks like that most people have logged on. So here's the question that David just mentioned. Do you think implicit bias affects access to homeless services? And we'll be able to see your live responses.
And okay, a few folks saying no. Most people saying yes. And I thank you all for participating in these type of questions, these type of activities, because as we build on sort of our presentations in Contra Costa, and we work with the CoC to provide additional trainings, this type of information helps us figure out, how do we best deliver this content? How do we best show to some people that, implicit bias does come into play? How do we show to some people that it does depend on a scenario? But this is so crucial to us understanding sort of each other, and also understanding where we are on the spectrum of working to end inequitable practices. All right, you all can continue answering that. Riley, can we go to the next one, please? All right, so we're waiting for responses. And you all don't have to type incomplete sentences. So please just definitely type your responses, and we want to see sort of what ways that you all have either experienced, because again, we're honoring the folks with lived experience in this session, or if you have witnessed implicit bias. Preconceived notions about people, absolutely. And again, you all, we all have them, and we all need to channel and educate ourselves and train ourselves what to do with those biases, right? Because I'm not saying that tomorrow we're all not going to have biases anymore. What I'm saying is we have to really figure out what is the rightful place for that bias, and how we can make sure that we're not negatively impacting people because we have that bias. Nice to have you back on, Matthew. Thank you for rejoining. I know the Wi-Fi issue can really be a thorn in our side. Oh, it's a lot of stuff here. Discrimination on race, misconceived notions on people of color and homeless folks, denial of housing increased increased financial responsibility, limited access to certain neighborhoods. That's a really good one, and that's a really compact one, right? So denial of housing based on a bias or based on perhaps source of income discrimination, all of those things. One of the trainings that I love to do is how do we help our clients fight discrimination? So those are things that we find come up a lot for folks. All right. No, you all are doing it. It's going to be a lot. Stigmas around people, communication or cultural misinterpretations. Absolutely. Again, our biases are created by the media that we consume, the places that we are raised in. So again, it's not necessary to say that it's negative. It's to say that sometimes we don't have all of the information that we should have in order to make decisions. We usually tend to focus on that bad information. All right. Thank you all for participating. We're going to keep this train moving. All right, give Riley some thoughts. I don't know. Again, it's 100 and how many people? 40 people here today. So while Riley is getting the deck back up, I'm just wondering if anybody wanted to say anything and come off of mute. You know, we always have that opportunity, but don't be pressured. Awesome sauce. Well, we're going to turn it over to Michelle.
Great. Thanks, David. And so excited that you're here in Contra Costa with us doing this training. So what I'm going to talk about is what is housing first. So as we saw at the poll at the beginning, we have a pretty big range of folks with experience. We had about 30% kind of in the beginning stages of housing first knowledge, and then about another 30% kind of in the upper ranges of expertise. So we want to make sure that we are doing level setting and making sure that we're clear about what are we talking about when we're talking about housing first. And then we are also going to be doing a number of kind of case studies and sharing out and learning from each other as well. So if you can go to the next slide, please. Oh, sorry, the one before that. Yeah, great. So what is housing first? It's an approach where people experiencing homelessness are provided immediate access to housing. So again, the housing first component, and then offered the supportive services they may need to foster long-term stability and prevent a return to homelessness. It removes unnecessary barriers and assumes that supportive services are more effective in addressing needs when the individual or family is housed, and when the daily stress of experiencing homelessness is taken out of the equation. Next slide, please. So when we're talking about housing first, we are talking about it from a place of 3 core principles. Principle number 1 is that homelessness is primarily a housing problem. I know there's been ongoing, but then again, it's kind of flared up recently, some narratives around homelessness being a result of individual choices, individual choices and circumstances. And we want to make sure to emphasize that homelessness is primarily a housing problem, not a result of substance use disorders or mental illness or weather or the generosity of public assistance. And it's really due to the fundamental mismatch between the cost and availability of housing. And structural factors play a huge role in causing homelessness. And including, as we were talking about, structural racism and then our own implicit biases as well. Second principle is that people experiencing homelessness should be returned to or stabilized in permanent housing as soon as possible and connected with the resources required to sustain that housing. So again, it's not housing only, but it is housing first. It's ensuring that people have a safe, stable, affordable place to live without preconditions or barriers. And it's also about ensuring that people have the resources that they need to stay in that housing and connecting participants with resources that they need as they're being placed in housing to be able to sustain it. And then the third principle is that underlying issues are best addressed once that person is in a stable housing environment. So it means that someone with a substance use disorder does not need to pass a drug test before they are housed. They do not need to be employed or have a stable income. They could have a criminal record, have been incarcerated, have a disability. Participants may have a chronic health condition that results in frequent hospitalizations. And all of these underlying issues are going to be more successfully addressed once that person is living in a stable housing situation. Can you go to the next slide first? Great. So who does Housing First work for? Housing First works for everyone, but it's most important and effective for people with complex service needs, people often turned away from shelter and affordable housing options, and people least likely to be able to proactively seek and obtain housing on their own. So in practical terms, this could be a person who has been incarcerated, needs to register under Penal Code 290 for a sex offense and is now seeking housing. It could be a person with a serious mental illness. It could be a family without an income. All of those scenarios are ones in which Housing First can be very effective at supporting folks in both accessing housing as well as sustaining that housing. Let's talk about some of the characteristics of Housing First programs. So the first one is few or no barriers. So what that really means is that access to the housing and then participation in the services are not conditioned on the person's sobriety, on their minimum income, their lack of a criminal record, or completion of treatment. It's not contingent on participation in services or other unnecessary conditions. So this also connects, all of these also connect, with the implicit bias discussion that we were having a few moments ago in terms of the preconceived notions that we bring into this work and the biases that we all have, and keeping those in mind when we look at how those interact also with having effective practices for Housing First programs. Secondly, reasonable accommodations. It means that people with disabilities are offered clear opportunities to request reasonable accommodations, both within the housing application and screening processes, as well as during their tenancy. So it should not be assumed that participants are already aware of and connected to the resources that they need or understand their rights to request reasonable accommodations. People are not rejected or terminated on the basis of poor credit or financial history, poor or lack of rental history, criminal convictions, or behaviors that might be interpreted as indicating a lack of quote unquote housing readiness. In terms of identification of alternatives, something that we want to emphasize is that situations where programs cannot serve a particular person, that they are still working within the coordinated entry process and within the homelessness system of care to support that household and access housing and services elsewhere. So that it's not, that if there is ultimately a situation where it's not going to work, that person is not returned to homelessness. Voluntary and client-driven services, that is a really big component of Housing First. So really having this be where there is a strong element of choice about which services a participant accesses and when. So it really emphasizes engagement and problem solving over having strict therapeutic goals. Participation in services and compliance with service plans are not conditions of a person's tenancy. And services are informed by a harm reduction approach. So it recognizes that drug and alcohol use and addiction are a part of some folks' lives, and that should not be a reason that they should not be able to access housing. And participants are also engaged in non-judgmental communication regarding drug and alcohol use, and also offered education regarding avoiding risky behaviors and engaging in safer practices. Flexible payment, we want to make sure participants are given reasonable flexibility in paying their share of the rent on time, and also offered special payment arrangements for rent arrears and given assistance around financial management. And then lastly, eviction prevention. So making sure that folks can stay in their housing, understanding, for example, that substance use alone without a major lease violation, for example, is not a reason for eviction, and that efforts are made always to mediate disputes and to maintain tenancy for participants. I'm going to pause for a moment, just make sure there's nothing in the chat. Great. And also see if anyone has any questions, or if anyone wants to come off mute and say anything before we go on to the next session. Okay, I'm going to turn it back over to Riley to talk a little bit more about the benefits of Housing First.
Yeah, thank you so much, Michelle, for introducing us to Housing First, or maybe reintroducing us for some folks. And this section goes over the benefits to Housing First. So we're going to be thinking about, like, why is this something we do? Why is this something we're committed to in furthering in our housing programs? So kind of the most simplest answer to why Housing First is because it works. It really is an evidence-based strategy to helping people end their homelessness. It promotes residential stability as well as social benefits for the participant in such programs. And it is also praised for being cost effective. That's not really the reason Housing First is successful, but it is important given restraints on resources in the homeless response system. It opposes kind of other more traditional strategies in the homeless response system that may require barriers to acquiring and sustaining housing, like something like requiring sobriety. And we know that those more traditional strategies, like transitional housing, are not as successful at ending a person's experience in homelessness. So some people are questioning Housing First viability, given that many communities across the nation are seeing an increase or seeing a sustaining nature in homelessness, but the success of Housing First is not is not responsible for the growing need for it. So we're going to go a little bit deeper on what it means, residential stability means. So Housing First, when implemented appropriately, has been proven by researchers to lead to greater housing retention in permanent housing programs and individuals longer stays in permanent housing. Studies show that evidence that this model's utility in serving people experiencing homelessness from both individuals from the street, living on the streets, and also from shelters. It works whatever situation the person is coming from. And it's also known to be effective in both urban and suburban environments. Just to kind of like give you I'm going to throw some numbers out at you if that helps you better understand the success of Housing First. So one study showed that like 88% of Housing First participants in 2000 remained stably housed over a 5-year period, compared to 47% who were participating in more linear residential treatment programs like traditional shelters or transitional housing. So that's a pretty big gap in terms of remaining stably housed. So that should kind of light some light bulbs about, wow, this program can achieve a lot for people. And I could provide lots of other data out there, but that's something in your free time you can find more evidence about why Housing First is a long-term success for individuals. The next slide is about social benefits. So the residential stability achieved by Housing First programs results and fosters some secondary social benefits for Housing First participant. So greater choice in housing and services kind of leads to significant predictors in a consumer's psychological well-being and social integration. And then also Housing First can lead to more satisfaction in an individual's housing choice. So living in a more independent, scattered site supportive housing is shown to lead to more higher housing satisfaction as compared to living in congregate supportive housing or community residences. Also, Housing First is known to lower incarceration and recidivism rates. The latter meaning lower returns to incarceration. And also, we found that Housing First programs don't have a greater rate of alcohol or substance use for Housing First participants. So there's communities often have concerns because Housing First has lower barriers to entry that it may change. It results in different behaviors of Housing First participants, but it's the data shows that it doesn't have a difference in participants' use of substances. So this next slide is that about how Housing First can be cost effective. So cost effectiveness shouldn't be decisive in determining a program's value, but numerous studies have demonstrated that Housing First can save money. In most cases, it costs more to leave a person living unsheltered or in an emergency shelter than it does to provide an individual with housing and case management. So Housing First models can reduce program costs overall and decline costs associated with supporting a person over time in the program. And it reduces strain on community resources outside of the homeless response system, like ER and police, because Housing First really can help target individuals with the most complex needs and serves them well too. So some studies have found that, or I'll give an example of Santa Clara County, which isn't too far away. So a study was done in 2007 through 2012 about about Housing First programs, and basically they found that Santa Clara County spent $520 million per year providing services for homeless individuals between 2007 and 2012. And it's estimated the top 5% of frequent high-cost users of public systems generated as much as 47% of the total costs. And then the other 95% of the low-cost users of public systems, like ER, police departments, generated 53% of public costs. And basically what they found is that prioritizing the top 5% for supportive housing placements, Housing First programs, can result in cost savings that that more than pay for the cost of their housing. So basically, this is just the point about if Housing First can really alleviate the strain on greater community resources outside of the homeless response system. But sometimes that can be hard to connect when our homeless response system is siloed off from these other community resources. So this research can help kind of connect these larger benefits that people may not notice because the systems are often siloed. But again, there's a lot more data out there. I have some in my notes, then just to save more time today, this is just something, a note to, if you're interested in learning more about this, there's lots of stuff out there that indicates a lot of the benefits of Housing First. But we want to spend some time to talk about kind of the essence of Housing First and how the cyclical benefits of it. And Housing First, the name itself, can sometimes spark apprehension, but it's really important to remember Housing First does not mean housing only. This is a phrase that Michelle had mentioned earlier. Services are part of Housing First interventions. They are not just mandated. Making sure people are stably housed and have access to services they may participate in leads to, as we talked about, greater residential stability, greater housing retention, and helps alleviate other underlying crises an individual may be facing. So that helps with the social benefits. Services and case management support Housing First, and also support housing second, housing third, etc. What I mean by that is that this continuation of services and case management throughout Housing First programs keeps someone housed despite the barriers that arise, not just at the beginning, but throughout a person's experience of being in Housing First. You probably all know today that the barriers don't just exist at entry. It's barriers kind of can come in waves and be unpredictable. So that's kind of what we mean by emphasizing housing first, but also housing second, housing third, doing everything you can to address barriers as they may arise. And this has really important implications for equity, as we've connected to this idea earlier in the training. But yes, this has really important implications for equity in our homeless response system, because Housing First ensures that the most marginalized and vulnerable individuals facing those systemic barriers and discrimination are not further marginalized. In an ideal situation, Housing First is treating every participant the same. But in order for Housing First to promote equity by removing discriminatory barriers that prevent marginalized populations from accessing housing, we kind of have to think about, like, how does that work? How is that possible? So we've put together here on a slide, and there may be more, but this kind of are 5 necessary equity components in a Housing First program that you need to be able to remove discriminatory barriers that may exist. So the first one is equal access. So Housing First should ensure that all individuals, regardless of their background or circumstances, have a right to housing. Then eligibility requirements. Housing First should prioritize immediate access to housing without preconditions or requirements. This is something we've noted, but we just want to connect this principle to its equitable implications. Then also, Housing First should prevent bias and ensure fair access. So training staff on fair housing practices, implementing non-discrimination policies, and actively approaching and addressing any instances of discrimination that happen are ways that a program can be ensuring that anti-discrimination policies are part of their Housing First program. Then Housing First should also understand and respect cultural backgrounds, languages, and traditions to ensure that individuals are receiving appropriate and equitable support. And the last one is Housing First should engage marginalized populations in a respectful and inclusive manner. So collaborating with community-based organizations, cultural groups, advocacy networks to ensure that the housing resources are accessible and available to all. And I hope that these equity components that we're talking about right now kind of connect to the Mentimeter poll that we were doing earlier, about how implicit bias can have an impact on housing programs and services, specifically Housing First, because you all brought up a few situations which would be violations of what these necessary equity components are. So I feel like a lot of you are already kind of thinking of these things, but we hope this makes the links and connections more clear. And I'm going to pass it off to David to do a scenario. But before we do our first scenario, just want to ask if anyone has any questions. So feel free to unmute or put something in the chat.
Hi, my name is Charlie. I was wondering about the progression of it. I'm loving the permanency of it, but like the transitional phases, is there going to be like a step down or step out program that helps the people move forward so that there's more space for incoming individuals?
You
You go
want
for
to,
David.
so what it sounds like you're saying is, Charlie, correct? You're asking about sort of where does Housing First fit in that transitional housing model, right? And the goal is to try to get everybody to permanent housing. We all know that, but we all know that we don't have enough housing for everyone. So even in a transitional housing landscape, right? We want to create housing first as a principle that applies to any type of shelter, any type of housing, right? The idea of taking and removing barriers so people can come in should they choose to come in, right? Is ultimately what Housing First stands for. Again, it is in the interim process, Housing First goes a step further in ensuring that that housing piece is a part of that transitional shelter, that transitional model, because ultimately we're working to get people to that step. And that's where you offer voluntary services. You figure out how to build trust and that in reach. I'll go to the comments in the chat that a few folks were talking about in terms of, I think it was mental health or substance use abuse, and having people, making sure that people have services for that as well. And again, here, what we're talking about is making sure that first people have housing, they have shelter to get into, because research has shown us time and time again that folks will be more successful with any type of program, with any type of service, if they are housed. If you are just trying to get people help while they are still in their unhoused situation, 9 times out of 10, we won't see the same level of success. So that's really what it's about. Again, we're not saying housing only and nothing else. We're saying let's focus on building that trust. And then there's another thing when you start talking about healthcare, asking anybody to elect to take services outside of that housing context. Many of us have not built a trust with people in order to get them to do things that we think are going to be successful for them. Many people in this country, we talk about historical trauma, historical racism, all of those things. Black people, I'm speaking for myself, do not have a good relationship with the healthcare system. Black people do not have a good relationship with the criminal legal system. So understanding what may be a barrier to someone getting help requires taking a step back and not pushing that help on someone, but actually seeing how can we build that trust so this person knows that they can trust this process if that is something that they want to receive. So again, not discounting anything that you all are saying in the chat function, but I think we have to think a little bit harder on how people have been impacted by these systems. And again, it's not your jobs to figure that out. This is hard work, as I've already said. I've been there. I've been a case manager. I know. So the reality of it is, though, we have to remember where people are coming from and how their past experience and even current experiences may be impacting the service delivery that they're receiving.
Thank you. I appreciate that.
No problem. Thank you for the question. Okay. But I love it. Y'all keep the questions going, keep the chat going. These are the type of things that we have to get. Yes, Selenia, meet them where they are. And again, it's about taking the time to understand why the barriers exist in the first place for that person individually. So scenario number 1, and again, we wanted to make this interactive. We're going to move to breakouts in just a second as well, so folks will be able to divvy the room up. Doing this with 140 people is pretty daunting. But a woman is referred to your PSH program. She has a substance use disorder and was recently discharged from the hospital. She is currently living outdoors while she awaits housing. She has stated that she is not interested in reducing her substance use. Now, the questions that we have for you all: which Housing First principles come into play here? What biases do you recognize in yourself as you meet with her? And what community resources or partnerships can help in this situation? And I promise you, we did not make these scenarios up, but this is absolutely very much on point with the conversation in the chat. So we're all thinking the same thing, right? And that's just amazing to me how that worked out. So again, first question, and anybody come off of mute, put it in the chat function. Which housing first principles come into play here? It's those 3 principles that Michelle talked about. Michelle, can you let people know what those principles were again?
Yes. So homelessness is primarily a housing problem. People experiencing homelessness should definitely be returned. Oh, thank you, Riley, to our stabilized and permanent housing as soon as possible. And then underlying issues are best addressed once that person is in a stable housing environment.
Once addressed.
Yep. So principle number 3, Brittany?
Yes.
Yes. So, and that's exactly right. We're talking about a PSH program, so permanent supportive housing program, that in its definition comes with supportive services, right? So she doesn't want to get clean. Now, in your head, what did that bring up? To me, she ain't gonna be clean. I might house her. She might be back on the street in a week. That's a bias that I may have, right? So how do I not let that bias interfere with me actually helping this person that shouldn't be living on the street? So those are the type of things, those are the type of questions, again, not to say that you all are not going to have them, but how do we recognize in ourselves as you meet this person? And then how does my attitude change? Because we're talking about building trust. So because she told me these things and she's probably being as honest as she can, she's not filtering her things like you and I would filter things. I could be thinking in my head certain things, but she's going to tell us exactly what it is. So with that being said, how do I affirm her choices, right? Make it so that we can get her in housing, so that we can get her the help that we may think that she needs, right? Maybe we can ask her, you want housing, right? You said the facts say that she's waiting for housing. She's talking to me, so she's already thinking about how to work with me, right? She just wanted to, I figure, you all have seen this. Again, I've done this too with outreach work. People are sometimes testing you and what you're going to do and how you're going to respond. So it's important for us to realize how we do that. And then thinking about community resources, we saw that in the chat as well. We talked, I think it was, I'm scrolling up a little bit. Community partners and programs, are here to support, but the property owners are making it easy for us to house our clients. That's absolutely true. And that could be a whole, I said, how do we fight discrimination against our clients? That could be a whole nother training that we talk about that, Brittany. But what community resources or partnerships could help in this situation? I'm pretty sure y'all can think of a few.
Question.
Nicole, did you have?
Yes, was that a question?
Yes, that was a question. It was.
Oh,
Sorry, I'm
I,
thinking back.
oh no, because my wheels was turned. I had a whole list of them. I appreciate everything that you're saying, and my wheels are turning as you're talking on how I would definitely want to help this person. But there are quite a few programs that after you house that individual that can step in to be some kind of assistance. Linking in AOD, or some kind of, well, she doesn't want the substance abuse. So I think it's really focusing on her housing. Is first start building that trust, and then probably getting if it was me, thinking back in my case manager days, although I may feel that I really want to help this person with the substance abuse, I do got to focus on the housing, but maybe try to build that trust where I can kind of figure out why she doesn't want it. Because the first thing I think of is I would love to be able to get her over to AOD, but try to understand why she doesn't want it first. And maybe there's another way around to get that type of treatment to her without her feeling like it's AOD, you know what I mean? Like,
Yeah, absolutely.
in a sense,
Absolutely.
but for her to be long-term and successful, eventually she does have to focus on that, or we will be looking at that revolving door. So this was something that I had to really grow to understand and learn and not put my personal feelings in that, because automatically I just want to help her, but I know I have to house her. So the first service I would think of is, even though she doesn't want it, it is tapping into my substance abuse friends to figure out, give me some guidance, even though she may not know how I can better help this young lady in a sense.
Yeah. I thank you so much, Nicole, for coming off of mute. And I pay attention to the chat. So, I hope you all get, and Letitia, I'm gonna call you in a little bit, call you in. It's not about making sobriety a part of housing. Think about how homelessness is a resource issue. Think about all the people in the world that may have a mental health issue, a sobriety issues, a substance use issue, but they have housing. So even in the statements that we're making is that it's frustrating that we don't have sobriety a part of this, because maybe, just maybe, it will make sure that a person is going to be successful in their housing journey. However, what values are we attaching to that statement? Because again, there's so many people who have these issues and they are not necessarily homeless because they have family, they have a support system, they have resource. So exactly what Nicole just said is what should be a requirement is developing a support system for this person, developing a family for this person, not judging this person, not being frustrated because she right now doesn't want to get out of her current situation. So all of those things, again, it is really about how do we shift our focus? How do we get our wheels turning? As Nicole stated in her comment, to get us to be a bit more creative and respond with empathy versus the initial response that many of us, again, I said when I read it too, here's another one, can't help them, don't want any help, but gotta house them. So how do we build that? And it really, we are talking about people, especially folks that have been living outdoors for that may be experiencing chronic homelessness and all these issues. There are really big issues going on here. So I can go ad nauseum. We could talk about this. This scenario is amazing. We have some more. So I think we're back to, I think we're going to do break. Wait, nope. Michelle.
Yeah, no, thank you so much, David. And thank you everyone for coming off mute, putting all this stuff. There's a lot going on in the chat, which is great. I also want to call out a couple of things here about listening, creating a foundation, building trust, creating a plan in their voice. So that's great. And I think what we're going to do actually, because this has been, we want to make sure we have time for really digging deeper into some more scenarios, is we are going to go to breakout rooms next. So when you all get a copy of your slide deck, there's some more slides next that'll be included that has some more kind of ground level information about Housing First and about a participant-centered focus. But we want to make sure that we have a chance to really discuss it more in smaller groups. So what we're going to do is divide folks into 3 different groups, and each group is going to have a different scenario, different Housing First challenge that we're going to be talking about. And then we are going to be coming back and reporting out as a group in about 20 minutes. So, and thank you again. I'm seeing a lot of stuff in the chat, which is great, showing that people are really engaged and having creative thinking, which is terrific. So with that, I'm going to, Riley, if you could go ahead and put folks into the breakout rooms. And then Jamie Jeanette is going to be in the main room. If anyone is having tech issues or gets accidentally kicked out of a breakout room or whatever, she'll make sure that you get directed somewhere. Any questions about that as we go through this?
Jamie, are you open?
Yeah, I can do
yours?
it.
Thank
And
you.
also,
Okay.
if you guys want to pause the recording, that way people aren't
Yes.
having a.
Maybe is there a new resource you learned about or a new way of thinking that you're leaving from this, or something that reinforced your current practices, just would love to hear.
Oh, don't make me call out on people because y'all were talking a lot in the group chat. Can't be a part of my group and then be quiet in the main group. Nope, nope, nope.
Go ahead, Teresa.
I love it, Brittany.
No, I think one thing that we talked about is, communication is important and not giving up. Just because somebody has the opportunity to receive services and they may not want them, you don't just throw them by the wayside. Like, you could work collaboratively with a colleague, case manager. I'm property management. So like if somebody is not communicating, we'll go ahead and take the other road, which is case management. Hey, if we need to see them, if we need to get inside, we're going to post a notice to enter just to see what's going on. Maybe we can't get in contact with them via phone. We're going to find, by any means to try to communicate and keep them engaged without being too intrusive.
Teresa was really describing, we had a scenario where we had a client in PSH who is not answering requests. She needs her unit, her yearly unit inspection, but they couldn't find her. So we really talked some strategies on making sure that we can get the unit inspected, follow the lease, but also not make up any rules where we're just kicking her out because she's not being responsive. So we know that that wouldn't be a housing first principle, and it's just not going to be well for the community anyway, because it's just more work to get her rehoused. So that makes no sense.
And
Anybody else?
in the chat, Ricky said, I found it very interesting. We have to continue to show up for our clients by all means necessary without judgment or downing spirit. So I'm glad that was the essence of the breakout rooms to you, that there's always opportunity to continue to show up for our clients more. What about for the other breakout rooms? What other takeaways do you have?
Just to kind of add on to what I was saying in our breakout room, I was kind of mentioning that in our scenario, it seemed like, while it was a housing first permanent supportive housing program, that some of the situations that led to the situation of the individual in our scenario were not housing first, and that we need to make sure that the programs and the implementation of the programs past entry is continuing on housing first principles, that we're not, kicking people out just because, they got, they're starting to experience addiction, or they're experiencing a loss of income. So making sure that, kind of like Riley said, making sure that it's not just housing first upon entry, but housing first continuing throughout the programs.
Yeah, that scenario in our breakout room was about a father with a daughter who had missed multiple rent payments, and then there had been complaints of them smoking in the unit, so the property management team issued a 10-day notice to pay or quit. So Jade's kind of noting is like the fact that eviction is possible for this participant, really like upholding housing first principles, which was a great question to pose to the group.
According from my group, I felt like what I heard a lot about was really meeting participants where they are and starting by building trust with them, by asking them what they want help with and what resources they already have, and how they would like to have the case manager show up for them. And there was a lot of expertise in the breakout room in terms of how you can access other resources and meeting folks' basic needs, but then also making sure that it's really coming from the place of what the participant is looking for, and building in that level of choice at every part of the process.
Michelle, we're gonna do a Mentimeter poll in a few minutes, just to further this reflection exercise. But we'll leave a few more a minute or two left for folks to continue to share their takeaways. And I see Joe just put in the chat something that Joe's learned being in so many ways, so many of these discussions. We follow the housing first rule, but the landlords and the property owners don't follow that. So it's important to keep having kind of discussions about how to outreach and continue to engage and educate landlords.
And again, I think there, Bertha actually, who's here, she sent me a message. I did a session on how to help your clients fight discrimination. And it was really for landlords and what things and education that you can do and all those kind of good stuff. So you all told me that this is an issue. So one of the trainings, future trainings, hopefully can be on something like that. I don't want to make too many promises, but it was a good training. It's very helpful. And that's another place where you can partner with legal services, partner with organizations outside the homelessness system of care. They already have these things. So, and it doesn't have to be an adversarial thing, right? It's an educational thing, right? If you're already working with good landlords, if you're doing this good work and the landlords see that they're doing a good work, why create an environment where we're just cycling people in and out of homelessness when we can do better to make sure that we can house them and keep them stable? So I am excited about talking about that too in future sessions. So thanks for bringing that up.
Yeah, thank you, David. Yeah, and during these trainings, we're always taking note of what are the specific things that you're all really looking to talk about and looking to learn more about. I think we will, Jamie just put a post survey for the training in the chat, but we have one little exercise left, just one more reflection activity. It's another Mentimeter. So I'm going to share my screen. And hopefully, yeah, you can see it now. And here are the joining instructions. So you can go to mentimeter.com and type in this code or scan the QR code. And hopefully it looks like Michelle already put the link in the chat as well. So you can just access it the easiest there. So we'll go to, as you're all joining, I'm just going to pull up the first question. So this is a question we already asked at the beginning of today's training. Do you think implicit bias affects access to homelessness? At the start, most of you had already said yes, but we kind of wanted to gauge, see if anybody's responses had changed. So it looks like maybe a few more people jumped from no or it depends to saying that yes, implicit bias does affect access to homeless services. And I see a few people putting that in the chat as well who Mentimeter may not be accessible to right now. All right, we'll move to, just for time, we'll move to the next question. So this is a scale question. We wanted to see if you feel more equipped at all based on today's training. It's okay if not, to address your own implicit bias when implementing housing first. So the scale is from strongly disagree to strongly agree. So it looks like based on the average, people are following in the agree, but maybe still working on perfecting your ability to address your implicit biases. But that's a continual process. It never ends. So thank you all for participating in that. We have 2 more questions. So the next one is open-ended. This is just another opportunity to not just share your takeaways from the case studies, the scenarios we did, but also what as you go out back into the world today, return to your jobs, your regular Monday to-dos, what are you taking away from this Housing First training? First response. Yeah, really hearing that communication is key here with the client, but also other partners that are part of Housing First programs. For some people, maybe today felt like a review of things that you've talked about before. Some people are saying that today you're reminded that we all need to work together. We have amazing service providers in Contra Costa. I like that's in all caps. Again, yeah, communication. There's always more work to do. I appreciate that humility there. We need a lot of diversity to help our clients. That maybe connects to having diverse representation of staff will lead to more cultural competency or ability to address implicit biases internally and meeting people where they are. Yeah, thank you. We'll look at these after today's training. Thank you all for participating. And then this is our last question, and then we're wrapping up and you all can resume your days, your Mondays. Just what additional questions do you have? And this will help us, we'll be doing, and a year from now, there'll be another Housing First training. So this can help us formulate what we can talk about in the future with you all.
And I would also say, if things come up afterwards, Jamie did put the survey into the chat, but if there's anything else that you want to reach out to us about, suggestions or additional questions, anything like that, you're welcome to email us. I'll put our email again in the chat.
Great. Well, thank you all. Yeah, feel free to keep filling this out. We got a few questions here. So thank you. And I will stop sharing screen. And yeah, just want to flag the survey again that Jamie shared to fill out before you hop off. Thank you all. Thank you all for participating. Is there any last items, Jamie? Reminders
No,
about
just
upcoming trainings?
thank you all for a tremendous training. We will send out the slide deck, recording. I'm going to also get the answers to the Menti survey so we can share those. I'm still working on the April training, but I did want to let folks know part of why I don't have the April training set yet is I am working to pull together one about how to best serve undocumented clients. And so that's taking a little longer to put together, but stay tuned. I was hoping to have that in April, but not totally sure. But that's there's a couple other trainings coming up, so we'll send out all that information. But hold second Monday from 10 to noon. We will have something for you. Thanks again, Home Base. That was tremendous.
Thanks, everyone.
Thank you.
You.
Be free.
Thank you.
Thank you. Bye.